Wel, bore da, pawb. Hoffwn i ddweud pa mor dda yw bod allan gyda phobl eraill unwaith eto, a siarad chi wyneb ar wyneb, ar ôl meddwl gwneud hynny am gyfnod mor hir. Good morning, everybody. I'd just like to say how pleased I am to be back out in public, attending these events and speaking to you face to face. After us, not being able to do it for so long, it's so good to be here and to actually be able to see people in the flesh. So it's great to be here. And thank you very much for the invitation to come here today. Diolch yn fawr iawn. The best thing about this job is going around and talking to people and hearing firsthand, what your experiences are. And I'm sorry that I'm not able to stay longer today than to have this this talk with you. But I know that the restrictions now have finally been relaxed, and so I know that I hope I'll be able to meet many of you in person again. I'm aiming to attend as many events and engagements as I can, and I hopefully get another chance soon to speak to you and hear about your views on the issues that are so important to you. Now, two of my officials, Julie and Emily, there at the back of the room, are here throughout the day, and I'm sure they would love to speak to you about any concerns or issues that you'd like to discuss. And they can also bring anything to my attention that they think that I need to know about. Now, I just want to say I fully understand the challenges that you've all faced over the past 2.5 years, and absolutely recognise that more than most, people with learning disabilities have been adversely affected by the COVID pandemic and the necessary restrictions we had to introduce to ensure your safety and the safety of those that you love. I also understand that as we emerge from and recover from the pandemic, people with learning disabilities, their families and carers continue to face difficulties in getting back to a place where there are services and support that allow you to live healthy, active lives as valued members of society. Well, it's another nice big group of people coming in. I'm sure that you will explore throughout the day that it hasn't been all doom and gloom, as the pandemic has in many cases forced us to explore new and innovative ways of doing things. And the rise in the use of technology and changes to the way we meet new people, communicate and share information is just one example of this. Shall I just wait a minute until everybody settles down? No, that's fine. There we are. I think everyone's got a seat now. So bore da to those who've just come in. I've only just started to speak. I'm Julie Morgan, the Deputy Minister for Social Services, and I've been talking I know how difficult it has been through the pandemic for people with learning disabilities and their carers and families. So I just think it's very important that we now look ahead to what happens next by taking the best that we've learnt in the pandemic, using new technology where it is appropriate, and combining that with more tried and tested approach to support in order to develop services that meet the needs of individuals, allowing them to reach their full potential and to be the best that they can. And that's what we want in the Welsh Government. We want to ensure that everybody can fulfil their potential. And as many of you will know, earlier this year, I published the Welsh Government's Learning Disability Strategic Action Plan, which sets out our learning disability policy priorities for the next 4 years. And this is supported by our Learning Disability Delivery Plan, which we launched on the 27th of October. And together these documents set out the Welsh Government's commitment to improving the lives of people with learning disabilities, their families and carers. And it also details the specific actions we'll take to achieve this. And I know many of you here today will have contributed to the content of these plans, and you have helped shape the approach to tackling the issues that I know are important to you. So I'd like to thank you for taking the time to do so and for helping us to try to break down the barriers that hold people back. And there is a major focus in these plans in ensuring that we build back better after COVID. Now, we do know that because of the need to take decisions quickly to protect vulnerable people in many cases, decisions were taken, services and support were changed without input from the people who were affected and had their lives restricted. And I know that this was not the right way to do things, certainly not an ideal way of doing things, and that's not what we want to happen in the future. But because of the nature of the emergency, we did change services and we did do things that we were forced to do. And voice, choice and control is important, and people must be involved in the decisions that affect them. Meaningful collaboration and genuine co-production are at the heart of many of the policies we want to develop, and we'll be relying on people with learning disabilities and parents and carers to help us shape the way things are done to maximise positive outcomes. So, we know it was such a difficult time, and I know that you didn't have much say about what was actually going to happen to you. We also recognise that advocacy and self-advocacy are important, and we'll be working with you all, our stakeholders and partners, to help design an advocacy framework for use across the public sector that meets the needs of the services and people that access these services. Rydym yn parhau yn gwaith o wella iechyd gofal cymdeithasol a lles. We continue our work on improving health, social care and well-being. Now, we do know how important health checks are in helping people live healthy, active lives. And when done properly, they identify health issues sooner and allow people to take the actions necessary which will stop you getting seriously ill. And we know also from feedback from you that health check process has not been working properly for some time, and the pandemic has made things much worse. So we're working to introduce a new person-centred approach that focuses on the needs of the individual and makes it easier for people to access a quality health check wherever they live in Wales. And that is one of our ambitions. Now, everyone with a learning disability is entitled to a health check. And I'd strongly encourage you to ask your GP for one. If your GP surgery does not offer this service, then they must tell you where you can get one. So you must make your voices heard. You are entitled to a health check. And we also know that accessing health services is not always the positive experience that it should be. And one of the ways that we're trying to improve this is by ensuring that all healthcare staff who deal with the public have the training they need to understand the needs of people with learning disabilities. It's absolutely crucial that people who are delivering vital services have some understanding and training about your needs. And this understanding, in turn, helps healthcare staff to make the reasonable adjustments necessary to allow people to feel comfortable and understand what's happening to them when they visit the doctor or go into hospital. So to help with this, I would urge anyone with a learning disability to make sure you have a health profile. This tells care staff about you, your needs and your preferences, and helps make visits to the doctor and hospital a better experience. You can get a health profile from the 111 website or your local advocacy group. I now want to mention local authority day services in particular, as I know how important these are for people. whether it's to meet friends, learn new skills, or simply to provide some respite for carers. I recently visited a fantastic Mencat Cymru Centre in Chepstow and was able to visit and talk with families and staff. And it was a really good opportunity for me to hear firsthand about the changes that had been made from the pandemic and how families had suffered from that. And I'm aware of the widespread concerns that day opportunities were restricted during the pandemic, and in many cases the support has now been significantly reduced. And I spoke to families at the centre who said the number of the days that their young person was attending had gone down from 5 to 3, how minibuses weren't available, and there'd definitely been a deterioration in the service. And this is having a negative impact on families because obviously their social connections are being reduced, and that of course is very detrimental. So we're working closely with local authorities, social services, to try to understand what is happening with these services and ensure that when they do reopen, they do so in a way that meets the needs of people with learning disabilities and their families. And I have to be honest, it doesn't seem that this is going to be a quick process, but I want to make sure that it is done right and that service users have the chance to shape these services to maximise their effectiveness. And you will hear some more about the work that we're doing in the spring of next year. Our action plan also sets out our commitment to work with partners in health, social care and education to improve services for children and young people across the public sector. We want services to understand the needs, make adjustment that meet these needs, and to work together to help provide seamless, integrated services. And this, of course, includes transition services and flexibility when moving from children's to adult services, school, education, employment. You've told us how important you think training and improving skill levels is for people with learning disabilities, as it helps find meaningful and paid employment, which itself helps support independent living. I absolutely agree with this, and I'll be working with my ministerial colleagues and officials to ensure that our training and employment programmes fully meet the needs of people with learning disabilities. And this summer, I saw for myself how the right training and employment makes such a significant difference to people. I attended Awyn Cultural Trust Belief and Would-Be celebration event in Bridgend, which was a fantastic occasion. And I also met workers with Down syndrome, supported by the Down Syndrome Association's WorkFit programme in Cardiff. So basically, I haven't got the time today to cover everything we're doing, but please rest assured that we are working hard to improve access to transport, improved housing close to family and friends, to ensure that people do not stay in hospital longer than they need to, and that when they do leave, they have the support they need. But of course, as we're all aware, the current financial situation is not making things easy for anybody, and we will have to make difficult decisions over the coming months. But I want to assure you, because there is a lot of stuff, in the press and in the atmosphere generally that is very gloomy, and I want to assure you that the needs that we do in the Welsh Government recognise the needs of people with learning disabilities and those that support them, whether professional service providers, social and care workers, unpaid carers or families. We will continue to do all we can to support you, including ensuring we have a happy, fully trained, properly resourced and funded health and social care workforce. I've already mentioned how important it is to hear the views of people with learning disabilities, their families and carers, and I would encourage you all to continue to get involved in helping us deliver design and solutions to problems and improve policies that meet your individual and collective needs. We need to hear your voices, so please continue speaking out. And of course you can do this via the local and national organisations that support you, such as Learning Disability Wales All Wales People First, Local People First groups, Mencac Cymru, the Down Syndrome Association, Cymorth Cymru, and All Wales Forum of Parents and Carers. These groups also play a vital role as the Welsh Government's third sector partners and key members of the Independent Learning Disability Ministerial Advisory Group. And that group is my link to the public, and they advise me and my ministerial colleagues on the issues that affect you and how best to overcome the challenges and barriers that are faced by people with learning disabilities. Diolch yn fawr unwaith eto am rhoi cyfle I mi siarad gyda chi heddiw. Thank you once again for giving me the opportunity to speak here to you today. I hope I can reassure you that the government, the Welsh Government, is absolutely committed to people with learning disabilities, and that we will do our utmost to help and develop services as much as we possibly can. So I hope you enjoy the day's events and the other speakers who are going to talk to you today, and I really look forward to seeing you at future events. So have a good day, and diolch yn fawr iawn.